Everybody, you know, we've been talking about the concerns out in Peoria with the water supply out there, and that the fact that some people believe that the deaths of these two young boys may be tied to the water supply. And so we want to talk more about that and maybe answer some questions that you have about meningitis and water. So we've got Dr. John Shufeldt with us this morning. Thanks for being here. Sure. My first question was, we've heard about meningitis outbreaks in schools before, in small communities. I didn't know you could get it from the water.
Well, actually, this is from an amoeba in the water, and it looks like these two children, possibly, the one link they have is drinking out of the same water.
Okay.
Or drinking from the same water.
Is this a rare sort of thing to happen?
This is actually extremely rare. There's some case reports of it happening. The last ones I read were in Florida in 1991, and I'm sure there's others out there, but it's an extremely rare form of meningitis.
Now, are the symptoms of this type of meningitis similar to the symptoms associated with other types of meningitis?
They're exactly the same. It starts off typically with a fever, headache, general malaise, it's not feeling right, and then kind of with this type of meningitis rapidly progresses until the point where it's diagnosed. The children or the people are very ill at that time.
Now, the symptoms that you just mentioned could be any number of things. But what I remember, when I actually had meningitis like 7, 8 years ago, and I couldn't touch my chin to my chin. I couldn't have a stiff neck.
Right.
Is that associated with this type of meningitis?
It's associated with all types of meningitis, whether it's bacterial, viral, or this type, which is amoebic meningitis.
Okay. What would be the warning sign, like you could tell parents, because I'm sure there are a lot of parents out there, a lot of concerns. What would you tell them?
Well, I think the take-home point is this type is extremely rare, and if you think of all these people drinking this water for this long, and 2 people have unfortunately contracted it, the chance of getting it are extremely small. The signs and symptoms are like that of any other meningitis, which is just really that's fever, stiff neck, and headache. And unfortunately, with this type of meningitis, by the time those symptoms really progress, particularly the stiff neck, the children are very difficult to treat, or the people are difficult to treat.
Okay, let's talk about when it comes to water supply in general. Most people just assume drinking out of the water, it's managed by the county. I'm probably safe. I guess for the most part, that's probably true.
I think chlorinated water particularly is safe. The chlorine's used to kill any bacteria or amoeba that are in the water, and apparently this was unchlorinated water that they were drinking.
Okay. What can people do to safeguard themselves? Obviously, everybody out in Peoria is still doing the bottled water.
And I think that's probably the only thing they can do at this point. Is the nice part is that the symptoms, once you have it, if you have no symptoms in 7 to 10 days, you're considered pretty safe. Mm-hmm. You cannot get it person to person, for example, either.
Okay. What about you with your children? What precautions would you be taking?
I wouldn't be bathing in the water or drinking the water. I'd be using bottled water until the city comes back or the county comes back and says, no, we've tested this water. This water is now in fact safe.
In general, is it a good idea to give your kids bottled water anyway? What would you say as a parent with your own kids?
Our kids drink tap water and bottled water, so I think in general the water supply is very safe.
And 2, they're getting the fluoride, right?
Exactly.
Which is important as well, because they take that out of so many bottled waters. All right. Sounds like just an isolated incident, but again, they're going to have to send those test results, which they have, to the Center for Disease Control in Atlanta, and they'll be doing the permanent test that we'll get back to find out what's accurate. Hey, thank you so much.
Thank you.
Appreciate the information, Scott. All right, let's go ahead and take some of your calls. He's here to answer your questions today, and the first caller we have on the line with us is Joan. Good morning, Joan. Oh, Leanna, I'm sorry.
You just corrected me on that.
I know. Hi, Leanna. What's your question?
My question is, my eyelashes have started to fall out, and I just would like to know if they're going to grow back in or not.
That's a great question, and I don't have a great answer for you, unfortunately. Probably the best thing to do is go to a dermatologist. Like, there are some conditions that cause your eyelashes to fall out. I guess the answer really is it depends on which condition you have that's causing it or which medication you're on that can cause it. So probably the best thing to do is go ahead and go to a dermatologist. If you don't have one, just call your PCP up and they should be able to refer you to somebody.
All right, good luck to you, Joan, as our next caller. Joan, how are you today? Hi, Joan. Hello.
While we work at getting Joan on the phone, I know that when you said there's a couple of conditions that when your eyelashes start to fall out seriously with women and hormonal issues, what types of conditions are you talking about?
Well, different medications you can take can cause your eyelashes to fall out, and then there are some different hormonal conditions. Lack of estrogen can cause your eyelashes to fall out, and then there's some other kind of weirder, more specific ones. Boy, off the top of my head, I cannot think of the name of them.
Come on, you're a doctor.
I know.
All right, do we have Joan on the phone with us yet? Lenny is on the phone. Hi, Lenny.
Hi, how are you?
Good.
Terrific.
What's your question?
My question is this. I had a hysterectomy a little over 6 months ago, and the doctor put me on Premarin. We have a history of breast cancer in the family. Is Premarin safe for women that have had breast cancer? Or history of breast cancer, I should say.
You know, the data is still out on that. I know there were some studies a while ago that hormone replacement therapy definitely has some concern for women with breast cancer. From my knowledge right now, people are still using hormone replacement therapy for women who've had their ovaries out or people who are postmenopausal. It's very patient and physician specific or dependent. So it's another good thing to talk to your own physician about to see kind of where they stand on it. If they prescribe it for you, I'm sure their stance is, let's kind of carefully monitor you.
All right, thank you very much, Lenny. Now we've got Epi on the phone. Hi, Epi.
Hi.
Hello, what's your question?
Are you a doctor?
He is,
This
not
man
me.
is the one with the helicopter.
Oh, okay.
I don't just play one.
As opposed to me. What is your question for us?
My question is, I've been diagnosed by pulmonary fibrosis, and there is no medicine for me. I'm on the oxygen all the time. What is I can use? They won't put me on a steroid, prednisone, and that already made me blind. I have to go for cataract surgery. Now, doctor, what is this I can do?
Well, pulmonary fibrosis is an extremely difficult condition to take care of. It is, I'm sure you're well aware, Epi. There are some medications like the ones you're on, prednisone, that people are put on to kind of stop the pulmonary fibrosis or at least slow it down. It's one of those unfortunate conditions that you have to kind of learn to live with. You'll probably be oxygen dependent for the rest of your life. And just very, obviously if you want to quit smoking is important if you smoke, but just really trying to keep yourself as well hydrated, well rested, and as healthy as you can.
Wow, that's a tough condition. All
Epi,
right.
good luck to you. Thank you for your call.
And thank you for all your questions, and thank you for coming today.
Thank you, doctor. We
Because,
appreciate your
Scott
time.
and I wouldn't know how to answer these things without you. We try to fake it, but it doesn't
Half
work.
the time, I don't even hear what they're saying half the time, huh?
Or understand it. Thank you very much.
Mostly
And there's the website for Dr. Shufeldt, nextcare.com. If you've got any other questions, thanks.
Thank you.
All right, we'll
Appreciate
see you
it.
soon.